Good morning, everyone, and welcome to the second session, which I'm quite keen for, quite excited for. Between ourselves, I think we've spread out but online and in person. So myself and Arabo are here as well, as you can see. And on the line, we've got Daniel McLaren from Section 27 and of the Budget Justice Coalition. I think we've also got Russell Rensburg, who's online. And we've got from the National Treasury, Dr. Mark Blecher, and I forgot to mention Russell is from the Rural Health Advocacy Project and also the Budget Justice Coalition. So I think a very nice mix of respondents, and we're going to kick off right off with Arabo giving us essentially a summary of the health and social grants aspects of the report. I'm not going to break up the session very much. I'll let Arabo jump right in, then open up for our respondents, and then have a kind of facilitated conversation. I'm very keen for that. We also will have some of the questions. I'm hoping that we'll have enough time to bring into the space, onto the floor, questions that we're getting from our online colleagues, online participants, and I'll keep an eye on Olwetu for that, who can jump in as she needs to. I should have started with saying my name is Zukiswa Kota, and I will be moderating this session. So I'll try to keep us to time, but I will definitely respect the hour that we were promised for this session all the same. I think the last bit was just in terms of housekeeping tea-wise, which is that we can. Yeah, I'll actually leave that for someone else to do. Okay, great. Arabo, over to you.
So good morning. Thank you very much, Zukiswa. Good morning to the colleagues online. Thank you for joining us. We'll be looking at the healthcare and social protection aspects of our report. And we'll start kind of where Michael left off, as there will be real declines in spending allocations to healthcare and social protection. And what I hope to cover in this section is that we'll go into the detail of that and how that looks like in the medium term. So with the COVID pandemic in 2019-2020, we saw that there was a decline in demand for healthcare, which resulted in backlogs as some of these services were waitlisted. But the system is slowly normalizing and coming into budget cuts that have been planned in the medium term. This will certainly put pressure on these services, and we can expect the system to experience somewhat of a resource shock. And so that's the backdrop to what we'll be discussing in this section of the presentation. So we can already see that in the medium term, that these are the CPI estimates, and only two items will grow faster than CPI. We look at total health spending that's projected to grow at about 2.9%, far below the CPI estimates. These two elements that will grow faster than inflation is the Human Resources Grant, which is paid to provincial health departments to train and place clinical doctors. And this has increased between 2018 and 2022. It has grown, it has almost doubled from about 2.8 billion to about 5.4 billion. And we can also note here that compensation of employees in the health sector will grow less than total health spending and far less than overall CPI, which means that we can already estimate that there'll be falling in headcount levels and the average pay in the sector will decline. So with the training of these doctors, we might expect to see an unbalanced health employment profile, with perhaps a prioritization of doctors over nurses and other non-clinical staff, who are all very important for a good healthcare system. We also see that in line with government commitment to shifting spending from consumption to capital spending, we see that buildings and fixed structures will also grow much faster over this time. So new construction of hospitals, renovation of existing facilities as well. But we also note that there has been underspending in the area of capital spending has always been underspent. And so we see that at best, this is optimistic, or we might have hospitals renovated anew with very little equipment, with few staff, because that's what the trends in the medium term kind of show. So We have other items as well, such as the treatment programs for AIDS and transfers to nonprofits and NGOs that will increase their share of the budget relative to the average spend. But compensation and allocations to central hospitals, provincial hospitals, as well as emergency medical services, those are likely to decline in the medium term. But another aspect of this constraint on the health budget is the issue of accruals. And essentially, accruals are unpaid bills. So you procure services now and you hope to pay off later. And we note that provincial health departments typically end the year with 1 in 5 of their invoices not paid, and they account for the bulk of the government's breach of the 30 days settlement of invoices. The graphic on the right looks at accruals between 2016 and 2020 across the different provinces, and at the far right we have South African average. And we're looking at accruals as a share of the healthcare goods and services spend. And obviously we see a mixed picture, but the bigger question is, what do these accruals tell us? Is it a question of fiscal pressure, or is it financial mismanagement happening across this different provinces? On the one hand, the budgets are constrained, and we've already seen how this is happening in the previous slide. And you come in with a situation where you have these accruals that are coming, these unspent bills, that when you receive your new allocation in April, you kind of have to start off paying off what you already owed from the previous year. And so you're faced with the choice of, do you spend on the other consumables that you need in the healthcare system, or do you settle some of those cases? So if it was purely a question of fiscal pressure, then you would see very similar patterns across the different provinces. So it must speak to an element of fiscal or financial mismanagement, because you have a province like the Western Cape and the far right next to South Africa's average that's much lower. So there's a mix of fiscal pressure and financial mismanagement across the different provinces. With this, it's not covered in the report, but also very closely related is the issue of medical legal claims, that these are not typically budgeted for, but we see that there have been increases across the past years. And where these payments are then due, it further crowds out much needed resources within the healthcare sector. So we then move on to the discussion of social protection. And once again, we compare it again with our CPI estimates. And I'd just like to note that the elements with asterisks next to them are not the allocations to the total item, but those are actually the grant amounts that are paid out. And if you were looking for a measure of what the social protection measure in the budget would be, it would be that transfer to households item, the third item. And we see that that also grows much less than CPI, but slightly better off than the average allocation to social development. We note also that the provincial social development, which typically pays for social workers who provide a myriad of services to the societies, that's also going to face pressure and grows at a very low 0.3%. Allocations and transfers to nonprofits actually grow at a negative rate, and these also provide key services to communities. But SASSA, which is tasked with administration of these various grants, has been seeing a reduction in the allocation relative to the total amount that's spent on social protection and so in the actual grants. And yet, in the recent years, they've also had to administer the SRD grant that has gone through them. So they're having to do that amidst, again, as we saw with the healthcare budget, we saw the compensation of employees it's facing, we're expecting low levels of headcounts and low average pay in the medium term. And so, yeah. So one of the things that we care about specifically with grants is the purchasing power of these different grants. And to do that, we looked at two of the largest grants. We looked at the old age grant and the child support grant, which in terms of the total allocation and in terms of beneficiary numbers, these are the largest two of all of the 6 or 7 grants that are available, easily over 80% of both allocation and beneficiaries. And so we created our own weighted inflation index to assess whether in real terms the beneficiaries, what has happened to the basket of goods that they were able to procure from one year to the rest. So we have the decile distribution of the grant recipients, and we have from Stats SA the decile inflation for each of those across the different deciles, and together we multiply this to create a weighted deflator. That then we see, so I must also note that in the calculation in 2019-2020, we excluded any COVID top-up so that we were able to compare the actual grants year on year, one to the next. And we see that until about 2019, there were significant long-term gains in the purchasing power. But in the medium term, any of these gains are likely to be eroded in real terms. And so not very low, but definitely much lower than the 2019 levels. And so in conclusion of this discussion of healthcare and social protection, we note the following, that spending pressures on the health budget reveal that allocated resources are inadequate to cover existing and future demand, that provincial departments of health are faced with chronic spending pressures together with financial mismanagement issues which further have the effect of crowding out much needed resources. Transfers to households, which I said is a broad measure of our budgetary allocations, that there's a contraction in real time over the medium term, and that the selected budget path shows that the real purchasing power for beneficiaries of the old age grant and the child support grant, that this will erode relative to peak levels in 2019. Thank you.
Thanks for that, Arabo. I think can I get a signal for who online will have first, or can I choose? I'll choose. Let's have Russell. So Russell's joining online, and he's joining us from the Rural Health Advocacy Project, and is also a member of the BJC. In fact, I'm glad that it's Russell first. Hopefully it is Russell first, just because the question of accruals is one that I've heard him speak about longer than I care to say. So I'm joking. Let's hear from Russell.
Thank you very much for a very interesting paper, and very interesting analysis of some of the choices that lie ahead of us. So in the first instance, we probably gave away quite a bit of money that I don't think we necessarily needed to, by not foregoing certain inflation increases, or on personal income tax, the reduction in companies tax, and in addition to that, also an increase in the amount of medical aid subsidies. So there's a kind of an implied choice that some lives are more valuable than others, and we indirectly subsidize the private medical environment through the subsidies, not just on the medical aid credits, but also in the decreases in company tax, which disproportionately benefit the privileged. The second component is that I think the budget tries to do some really difficult things by maintaining the state of the current system. But that maintenance is not good enough, because already in 2019 or as early as 2017, we were reporting large-scale vacancies across the health system. And after the COVID shock, we maybe had some increases, but that increases in human resources somehow was limited within the larger cities, often to the detriment of smaller rural districts, which make up 41 of the 52 districts currently in the country. So does the budget meet that notion of equal enjoyment of rights? I think no. Does it treat everybody equally? I think no. Does it strengthen our ability to respond to a broader health crisis that we've been experiencing for a much longer time? I would suggest that in the current trajectory, it weakens, maybe not by design, but it certainly will. And then I think the next comment linked to that is that budgets do have limits, and budgets are political choices, as Edgar so eloquently illustrated earlier. And those political choices seem to be putting the interests of economic growth against those of the constitutional obligations of the state. The Health Systems Trust, for instance, recently published a USC index that looked at South Africa's progress on universal health coverage between 2009 and 2017. And up until 2017, we were doing relatively okay on an aggregate level. But when we started, where we were achieving an index of just over 62%, but that achievement wasn't equally distributed across the country. And I think that's part of the problem with the budget making, that we look at a one-size-fits-all approach to financing health, right? But when in fact our contextual realities across the difference means that we need different strategies in different places. And I think emerging out of this crisis should actually be presenting an opportunity for us to start relooking how we finance healthcare rather than just focusing on the inputs. Arabo made a comment on the growth in human resources for health grant, which again is an important statutory obligation that the state has to provide opportunities for internship and for community service. But in the context of a declining health workforce, I have to ask the question around how do we balance out the need to train new doctors and nurses and all of those others that are funded out of the community service component and not necessarily internship, with the need for a strong receiving health system to mentor, to train, and even to make them functional healthcare workers. Added to that, we also have a bit, given that we haven't really added that much new capacity since 2012, we also have to start looking at what is the broader demographic within the health system. We know that in nurses, almost 50% of them are already around the age of 45 to 55, and so maybe nearing retirement. So I think some of the choices that we're making right now are imprudent to our longer term goals. We're making very big bets on possible economic growth, and the outlook for economic growth is not great because we have a political crisis, we have a global economic crisis. So the worst case scenario is that we're probably closer to the projections that Michael made earlier, that we will probably have a primary deficit. So unless we have a drastic change in how we look at the process of budget making and distribution, we may be headed for a much bigger crisis than what we currently have. I'm also cautious about, for instance, the conditional grants, which may be growing, but it's important that the name of that grant for HIV and AIDS and TB has been changed to a district health services grant. So I understand there may be some flexibilities within this new grant framework for how provinces spend the money. And the risk there is that as the provincial equitable share is declining, we could be dipping into these grants and then undermining our ability to meet the strategies, both for TB, where we're looking at drastically improving our treatment coverage rates there by finding the 150,000 missing patients. And then secondly, to increase the amount of people living with HIV on treatment, which is currently only sitting around 60% of the total population of 8 million who are currently living with the disease. So we've got some big goals that we need to achieve, but how we achieve that in an environment of extreme fiscal constraint without extreme protection really is what challenges me. And I'd really like to understand how we will mitigate some of these risks going forward. Or are we going all in on hoping for infrastructure-driven economic growth, which hasn't delivered in the past? I think the paper makes comment that those budgets have largely been unspent or underspent. Similarly, we know that there's a need for medical devices. Arabo also makes comment about the fact that we haven't spent those grants. So for me, I think we have a structural problem in our health system, and the budget is enabling that and is not necessarily allowing for us to take a different decision path towards improving rights realization. Thank you. Over.
Great. Thank you, Russ. Thank you. I think we'll hand straight over to Mark for his inputs now.
Okay, great. Thanks. And good morning to everybody. So thanks for a great paper and very good analysis. I think I want to take a slightly more positive perspective than some of the previous speakers, although, not to be over the top with it, but perhaps to give a slightly different perspective. So I think firstly, it's important to note there's been great instability in the budget in these 2 years since COVID. So there was 264 billion cut off the overall budget non-interest expenditure in the 21 MTEF, and 282 billion added over the 3 years in the 22 MTEF. So, that's just a sign of the huge instability, and hopefully we might see further stabilization in the next budget. But I think also it's important to notice that 282 billion was added in budget 22. it's not that nothing happened in budget 2022. 282 billion was added. And amongst that, there were some significant additional allocations to social development and health. And I mean, and those are detailed in table 5.1 in the budget review. Something that you haven't looked at in your analysis is the share of total spending, the share of functional spending. So what we see here is that social protection goes into second place, overtaking health in the SAMTEF. So if the order of percentage spending in the functional spending areas was education, health, and social development, it's now interest payments, school education, social protection, health, and ESCOM. And ESCOM might be overtaking health. Its revenue, it was 134 billion in the first 6 months of 21-22. So if that continues, it may actually overtake health. And I think it's important also not to minimize the effect that the crowding out of debt is having. I mean, the spending on interest payments has grown by 150 billion a year. So whereas the non-interest expenditure graph is looking pretty bad, the overall expenditure graph is looking fairly reasonable. So the cost of debt is playing a big part of this picture. So, I mean, if the overall topic of this session is prioritization and what's being prioritized in terms of spending, I mean, the areas that are gaining are interest payments, higher education, social protection, the road accident fund, ESCOM, and the loser are things like protection services, administration like home affairs, agriculture, and some others. And I think it's important also to recognize that as a country, the way that we dealt with the COVID pandemic, in a sense, the balance between lives and livelihoods, shut down the economy for a long time. And it's pulled through in terms of not just growth, but tax revenue and spending. So let me come briefly on to social grants. So the social sector received the largest additional allocations in budget 22, and that's fairly clear in that table from the budget review. It goes, as I mentioned, on a proportional basis into the second largest share of spending, overtaking health. Gains as a share of spending from 12.8% in 14-15 to around 13.7% in 24-25. And that's even without the SRD 350 grant. So if that grant continues in some form, that share is going to go even higher. And there are three major parts of that additional allocation. It was the 44 billion for the SRD grant, about 5 to 7 billion for inflationary adjustments. And let me just say that the way that our team, in a sense, calculates in our social grant projection model, the numbers that we have on the real values of social grants is somewhat different to the estimates that the WITS team has made here. So we have tried to address inflation in those additional allocations. In fact, that attempt to, in a sense, fix the cuts, the 264 billion cuts from the 21 budget, social development was virtually the only vote, one of the only votes that had those virtually completely offset. And then there was the orphan grant. But the big issue, really, the big major issue, if social development is gaining in share, was the SRD grant. And if the SRD 350 grant continues in next year, it will not be funded through expenditure or reprioritization largely. I think the Treasury has been fairly clear that if that grant continues, and the cost of continuing it is fairly substantial. I mean, it will be of the order of 50 to 60 billion rand. And, in the event that the commodity boom does not continue, which is unlikely and not in the current revenue numbers, that's going to need to be financed by a fairly substantial tax increase. I'm not going to go through the exact levels of the tax increases that might be required to fund a 50 to 60 billion spending increase, but they would be very substantial in the next budget. And, one needs to ask in the context of that, if there's such a significant reprioritization to social protection spending as the second largest share of the budget, and it's going to cost us 50 to 60 billion, it may be a good tool maybe a very good tool, but is it the best tool? And just some issues is that the soldier work estimated that the cost of the poverty gap in the country below the food poverty line is around 45 to 63 billion, according to two estimates. The difficulty with the SRD grant as it's currently formulated is even though you can spend 60 billion, in other words, the entire amount of the poverty gap, that the modeling suggests that it won't eradicate that poverty gap. In fact, it will eradicate it by say, about half or perhaps even less. And that's partly because of the problems of specificity around the grant, where it goes way up, beyond the lowest decile households, up into deciles 4, 5, 6, 7, 8, and even beyond. Whereas there are around 8 million people in the poorest households, there are about 16 million potential applicants under the current grant. And the grant is not linked to some of the other issues that are relevant to the working age, things like linkages to work, skills, and pathway management. So it may be a good tool, but is it the best tool for 60 billion? Then on health, as a share of spending, it's fairly flat if you exclude interest payments. Of course, decreasing if you include interest payments. Possibly a slight decline in the out 2 years. I think where the paper makes a very strong and good point is that the current budget sees substantial reductions in 23-24. In fact, that might even be the largest reductions in health over the past 3 or 4 years, and that is a worry, and it's something that we need to keep relooking at and discussing, because also the way that health, the increases, the 15 billion that came back to health in budget 22, it came back mainly in year one, mainly for COVID. But there are significant reductions in 23-24. So that is a problem, and it's a space we're going to have to keep a very close look on, also in the preparation of budget 23. I think it is important to mention, though, that it's not unlikely that there are going to be wage increases, which are not yet factored in. So as those wage increases come in, that those would then push up some of these baselines. But I agree with analysis that the current real per capita graph, though, looking into the outer 2 years, is pretty miserable looking. Now, it's perhaps also interesting to note that the number of doctors has increased significantly from about 20,000 in the public sector to about 24,000 in the last month. So about a 4,000 doctor increase. So the number of doctors on the ground is it's not as negative as the general picture that's being described. The general personnel increase in the public health sector has increased through COVID from 215,000 posts to 230,000 posts. Now, obviously, it's worrying given the fiscal consolidation that's been described. What's going to happen to that in the coming months, and particularly going into 23-24. But as we sit today, we're still sitting at about 15,000 posts up. Something else that we need to also look at is that there were substantial changes in output and performance trends with COVID because of a lot of interruptions in services. So primary healthcare visits, hospital admissions, and so on were fairly substantially reduced. And we need to see to what extent also those, in linking budgets to performance, we also need to see to what extent those output levels are coming back. But also, of course, the question about how disrupted services are restored. So just to close off, the 22-23 budgets do see a real reduction of about 7 to 9 billion. And some of those are in significant areas, like in medical supplies, around a 700 million reduction. So those are issues that we're engaging closely with provinces, also in the 3x3 structure, and something we'll continue to look at in the course of this year. However, we are more worried at the moment about budget 23-24, and if those current budgets remain, what that's going to mean for efficiencies within services and how they will be achieved. I'm not even going to get into now what all these budgets mean for the national health insurance trajectory, just given that I'm well already over my time. Okay, back to you, Chair.
Thanks, Mark. It is tricky to do, timings for people online. So you guys are probably going to get away with little overtime. But thanks for that, and thanks for keeping more or less to time. Our last input from our respondents is from Daniel McLaren from Section 27 and the BJC.
Hi, everyone. Thanks, Zuki, and thanks for the invitation to respond to this report today. I won't repeat some of what Mark and Russell have said. I'll try and add to what they've said in relation to health and social grants and what has come out in the report. Before I speak to those, I just want to firstly just talk about the accessibility of the report and the data sources used, and really just welcome the fact that we're having a big discussion about fiscal policy and government spending choices, but the report tries to enable us to have that discussion in an accessible way through how the budget information is presented and the kind of concise narrative around it, which is really helpful for the discussion. And I think also presented in quite an honest way. For example, as Arabo was talking, the actual inflation rates are taken into account when we're talking about how much we're spending on health, how much we're spending on social grants, the number of healthcare users, the number of learners in the education system are talked about in the discussion on education funding. And that's absolutely critical, because that shows us in real terms what the budget means on the ground in terms of funding per learner, funding per healthcare user, and what the value of social grants can buy. And it's in stark contrast to the budget review, which often presents its own kind of narrative, which tries to show kind of nominal increases and overall consolidated increases in spending, but doesn't focus on the important detail of what that spending is actually purchasing in those different areas. So I think I would encourage the Public Economy Project to even go further in terms of making the budget data even more accessible, and providing more tools, infographics, and maybe interactive data tools and other guides to the budget and budget literacy tools, and maybe trainings to make this kind of discussion even broader in the public realm and even more accessible to people. The other thing I want to welcome in terms of the approach taken is this approach on kind of trying to illuminate and to present the choices that face us in this very difficult fiscal and socioeconomic environment that we face. And I think that's really useful for groups like the Budget Justice Coalition, which are seeking to facilitate and enliven these kinds of discussions, because when the choices are put on the table, they can't be ignored. And even if they're controversial, for example, around the wage bill or state-owned enterprises, for example, just to name two, when they're kind of put on the table, you can start to think about the politics behind the choices which are being made, and consider what the alternatives to the kind of unsustainable status quo could be. I just want to make a comment then as well about fiscal policy and the budget process and the role of the National Treasury briefly, because this is something which Budget Justice Coalition discusses a lot, because every sector is impacted in its own way by budget squeezes of the past decade. And I think every sector in one way or another has increasingly seen this as one of the core barriers to quality service delivery and accessibility of services, whether health or education or other areas. And it would appear to me in my reading that the report does support the view that the approach to fiscal consolidation, which we talk about as an austerity policy, has been that's been taken so far and continues to be taken in the 2022 budget, is unfair in that it does entirely premise the fiscal consolidation on spending cuts, while at the same time it does provide a tax cut to corporates, it does provide tax relief to affluent households, and it freezes taxes on fossil fuel consumption. And it's no longer a revelation to us, but it should be that in the report that in the most unequal country in the world, that the budget is actually going to promote more inequality it's just a major failure of our budget process and our fiscal policy, that is the conclusion that we come to when we evaluate our fiscal and budget policy. So what I would just add is that in addition to the political failure, which is quite clear and which the report recognizes, the political failure to provide a vision, to take decisions on key issues, and to steer a consistent course is clearly there. But I think there's also failures in terms of the budget process itself and on the side of the National Treasury as the institution which is ultimately responsible for charting a sustainable developmental fiscal strategy. And just to give a few examples of why I say that, if you look at the inconsistency, yes, we've had COVID, as Mark says, in 2020, 2021, and especially with special adjustment budgets and all the rest of it. But if you look at the trends in the report, for example, on capital spending being cut significantly between 2016 and 2022, and the downturn in employment and economic growth during that period, and then this kind of U-turn from 2023 onwards, where capital spending is seen as the kind of, now that's what's going to lift us back towards growth. At the same time, this ongoing emphasis on cutting consumption expenditure, which the report notes, and yet this has huge impacts on health, education, policing, judicial services, which are all personnel heavy, but that isn't discussed in the budget policy, whereas this report at least shows what that impact is. And generally, the lack of analysis in the budget review and in the discussions from the National Treasury of the impact and the cost of budget cuts themselves on service delivery, on state capacity, and on people's rights is something which I think needs to be illuminated much more. And I would argue that in the spending chapter in the budget review, there needs to be much more information and discussion on the benefits and costs of spending choices which are being made, including the costs of austerity, because probably 80% of the budget review sort of is focused on fiscal indicators and economic discussion. And if that's all you're focused on, then you will come to this conclusion that spending maybe just does buy more debt. But the fact is that spending doesn't just buy more debt. Spending actually puts food in people's bellies, it puts income in people's pockets, it puts books in children's hands, it gives people access to healthcare. It has lots of positive effects. And in the same vein, when we're cutting expenditure, that has serious negative effects. And I think the budget policy that we're discussing at the moment doesn't take account of those effects and those impacts. And there needs to be more discussion and more evidence about those included in the discussions. The report says that essentially this austerity going forward is looking like the GEAR program, but kind of condensed into a single year. And the organizations in the Budget Justice Coalition are understandably very concerned about this. And I think I would support the call in the report to prioritize the protection of frontline services and to limit the fall in public employment and the approach to fiscal consolidation going forward. And to support this, I think I would also encourage the PEP Public Economy Project to also consider using more of a human rights-based approach. I think if when it comes to looking at budget choices, I think if we're looking for a kind of middle ground or a ideological framing for budget choices, the Constitution and the human rights framework can help provide that. And I won't go into the kind of ways that the norms and the standards and the kind of approaches which have been developed in South Africa and internationally to thinking about fiscal consolidation in the context of human rights. But those are available for us, and they can provide useful kind of guiding tools in budget policy. And then the second from last comment is on the question of gender responsiveness in budget planning and evaluation. So the report does, as Gilad highlighted at the start, it does recognize that current fiscal policy is likely to increase inequality. But I think that in future reports and in the evaluations of macroeconomic policy to come and the evaluations of tax policy to come and going forward on spending choices, I think it would be really useful and necessary to include analysis of impact of budget policies on gender equality, on access to public services by women, gender non-conforming people, by the whole LGBTQI plus community. So when we're talking about cuts and impacts in the criminal justice system, for example, we see how that translates into impacts on gender inequality and women's disempowerment. And I think that we are seeing some small steps in the right direction on this from government, but this kind of project could do a lot more to put that on the table and push that agenda forward. On healthcare itself, I won't repeat what Mark and Russell have said. I would just highlight, it's encouraging to hear from Mark that there has been an increase in doctors employed in the public service in recent months, and that's very encouraging. And of course, yes, there's this question of whether those COVID related posts do become permanent. I mean, what we see in Section 27 is a health system really stretched to breaking point in Gauteng and Eastern Cape and in other areas. Anyone can log on to the Daily Maverick and read really harrowing reports from doctors which have been posted in recent weeks, describing conditions in our public hospitals and our maternity wards. And it does seem very clear to us that while there are issues around the management and the organization, as this report shows, the lack of funding to actually fill vacant posts, to buy the necessary equipment, to send people to actually reduce waiting lists which have accrued over the COVID pandemic is a major driving factor. And again, on this question of considering cost today and cost tomorrow, which I would argue that kind of fiscal policy of austerity pushes a lot of costs down the line. And we see that especially in healthcare. So for example, if you don't service a person early in the medical system and attend to their medical needs early, the needs that they have only get greater and servicing them becomes only more expensive. They need to spend more time in hospital, they need more specialist care. And that's just one example. Another example that we've seen at Section 27 is the link between the lack of staff and then medical mistakes. One nurse, we have a case where one nurse is looking after 20 babies in a neonatal ward, and mistakes happen, and this leads to medical legal claims. And whilst there have been lawyers kind of preying on this issue, there's so much meat for them to chew on because of the mistakes in the system due to staff shortages. And this just creates costs down the line. So I think that needs to be taken into greater account in the analysis. And then just finally on social grants, I agree that the budget is unrealistic and foreseeing essentially the total end of the 350 grant in 2023. It does note that in the budget, and we clearly need a political way forward there. And again, just to appreciate the focus in the budget and from Arabo in the presentation on the issue of the real value of social grants, which doesn't come out in the budget documents. So those would be my comments. Thank you. Hope I didn't go too over time.
Before I hand back to Arabo for any responses she might have or any inputs on what we've heard, I think there's a particularly interesting thread, an overarching thread that came from earlier in the morning, and I was sad I missed our very beginning, but is this aspect of looking at public budgets as indicators of real political decisions and choices, and what it means when those kind of resource choices are made. Russell and in fact most of the speakers also have emphasized something that was in the report as well, which is around the constitutional obligations and what that means. I think it's interesting Daniel's point around perhaps the report potentially going further around emphasis on the human rights obligations aspects. And I think perhaps the other point of emphasis that's come out and is also raised in the report is the importance of public deliberations around budgets and fiscal policy. And I think, again, that's something that's been appreciated by a couple of speakers in both of the panels. And I'd also just like to reiterate that and maybe just to think about what that means. Daniel's raised some suggestions, and maybe Arabo, if you do have responses to that, it might be interesting to hear. So I think on this particular aspect of health and social assistance, it is something that's been quite emotive in the media. It's something that many activists and researchers are really working hard at. I think our inputs from the panel were quite interesting. A bit of mixed in some respects. There was a little bit of positivity, or kind of I think Mark said, let's not be, there was some positivity there to some extent, which was reiterated by Daniel. And I think the emphasis and around the cause for concern around the 2023 and 24 budget reductions is something that is, emphasized in the paper, comes through in some of the concerns. Russell touched on this aspect of, uncertainties and particularly around what it means for the bottom line and the people most affected. So I think there's a lot there, and there's some aspects, some suggestions around, towards the report made directly, some overarching appreciation for what's on paper, and I think one sort of phrase that hit me hard in terms of what we're looking at is the phrase political failures that I think Daniel emphasized. But with that, there were some specific aspects that were raised as well, Arabo. I don't know if you want to respond to that before we open up for questions and go back to our panelists.
Thanks, Zuki. I'll try to go through some of them. One, thank you very much. I guess as the team, it's always nice to present something and get this kind of feedback. So we welcome all of this kind of engagement. The one takeaway from Russell's kind of presentation was that, look, the budget shows that there are other structural issues within the health budget, and it's not probably best placed as it is now. So saying you'll kind of prioritize capital spending, but in the past you haven't necessarily gotten to do it right. So what's going to change? So it's interesting that he could also see that as well. I do take the point about there's some distributional aspects that we don't necessarily discuss, and I guess in light with what Gilad also brought up in the morning around, what Mark was talking about, that the SRD grant is one thing, but people of the 18 to 59 age group who qualify for this grant also have other labor market access issues that they're not, labor market and other issues that they're not necessarily getting addressed. So this is just one of many things. And so it was quite interesting hearing him talking about a poverty gap. And in the paper, we haven't necessarily gone into that kind of a discussion. So whether here or in the upcoming work that looks at the resource allocation, that's definitely something that we could consider. It was also interesting to hear about the increases in vacancies, in the hiring and recruitment. What I would want to know from maybe Mark is, what does the hiring profile look like? Is it just doctors, or are we seeing doctors, nurses, non-clinical staff as well? I think what Daniel raises about the human rights approach also came up in the earlier comments from the earlier section around looking at it not just from the Constitution, but also the NDP or any other kind of framework that will give us an opportunity to look at how targeted the budgets are. And then just finally, Daniel's point around the medical legal claims and how he almost tied it to like staffing pressures and things like that. Definitely interesting to read more if he has in that line. I'll stop for now.
Great. Thanks, Arabo. I'm looking to Oluetu to see if we've got questions and if she's got a mic.
Oh, sorry. We do have one question online. It's from Neil Coleman. It's directed to Mark Blecher, and the question reads, Mark suggested that the SRD grant wasn't the most effective way of reaching the poor. What is he suggesting as an alternative?
Okay, let's hand back over to Mark, and maybe just to add to that for Mark, I'd had that noted as well as a question, but I was maybe give Mark a chance as well to answer the question around hiring profiles as Arabo raised. And a third bit, Mark, this is more for me. I may have missed the point you raised about inflation-related considerations. I think it was in relation to the social assistance budgets compared to, how you do it or the Treasury does it versus how it's done in the report. It may have been clear for others if you could just maybe elaborate on that. So those three questions for Mark.
Okay, thanks for the questions. So it's difficult to answer on the hiring profile just briefly. I have the file open that we draw down regularly on the full posts throughout the sector. So I could possibly also share some of that data with with the person who asked that question. As I mentioned, there's been about a 4,000 increase in doctors, about a 15,000 increase in health workers overall. Now, some of those are starting to taper down slightly over the last 3 months as we see the effects of these tighter budgets this year coming into effect. Noting, of course, that the budgets were substantially increased over the past 2 years with COVID. So, I think we're going to need to see how those numbers play out in the coming months. So I'm sorry, I can't give you the detailed profile by category immediately. It's just difficult to talk to them and look at the spreadsheet at the same time, but I'm happy to share them with the colleague who asked the question. Okay, on the question of inflation on grants, so normally, neither the Minister of Finance or the Minister of Social Development give the projected forward values of the social grants beyond the actual year in consideration. So, for example, the Minister of Finance, in his budget speech, says that the number he's discussed for the value of the social grants for the 22-23 years is as follows. But he doesn't say what it will be for 23-24 and 24-25. So the researchers here have made a calculation on what they took from the numbers as the way they've calculated, but those numbers they're not in the public domain. So I've compared their calculation to our actual forward projections in formulating the 5 and 7 billion rand grant increases, and our social grant value numbers are slightly different to their numbers. I don't mind engaging with the researchers on those, but they are slightly different. We have tried in our numbers to compensate for the effect of CPI on the main grants going forward. So, happy to engage on the details of that. Of course, I think it is also quite reasonable to argue that CPI may not be the best indicator of the cost of food inflation for the poor. So it may be that CPI is not the right measure to use in comparing social grants. But we have tried, and we were quite pleased to be able to at least get an offset substantially of the cuts that were made in the 21-22 budget. And as I mentioned, if you look at that table in the budget review, social grants was in fact the largest sector of increases the actual total quantum of increases in budget 22. On the question about what alternatives to the SRD grant there might be, I feel a bit reluctant to talk about this now because it's something that both ministers have spoken about in their budget speeches, that there's a lot of work happening in government around this. So I'm not really in a position to speak for government on this. There's just deliberation going on. But the kind of two questions that I raised in what I said earlier is firstly, the question about does one want, for example, if one continues with the SRD grant, to be, in a sense, the same as like the child support grant is, or the old age pension. In other words, it's just simply a grant. It's 350 Rand or adjusted by inflation, whatever the amount is. Or does one want to look at its linkage to active labor market policies, skills acquisition, linked to a pathway management system, and other kinds of employment-related interventions, or even the extended public works program? Because, is it a satisfactory intervention to have young people, for example, from 20 to 30, simply getting 350 Rand? Presumably not. What is actually the set of interventions that's required? So I think that's one area that we're starting to think about. The second area is just this question about the current SRD grant is very much based on the individual's income, and that causes a specificity problem. It causes the grant to go too low but too wide, because 350 is actually not enough to address food poverty. The food poverty line is 624, 350 is actually too low. But because of the specificity of the current grant, for example, you can be a teacher or a policeman or woman, for example, and your spouse can get the 350 grant because they don't need to declare your income. So is that what we want in a very, very resource-constrained environment? So in a sense, if the grant was more specific, for example, if it looked at spousal income, it might be more specific, and that might allow for actually a higher grant in time. Because at the moment, if the current trajectory were just maintained, this grant will trend up to 60, 70 billion or so, but it won't eradicate food poverty, because it just doesn't eradicate the food poverty gap because of the way the grant is structured. Perhaps I could leave it there. Thank you.
Thanks, Mark. I saw that, actually Arabo noted that Russell's hand was up. Russell, I'm not sure if that's a response. Yeah, please go for it.
Yeah, no, really, I think the increases I think Mark, Treasury's done a great job, like I say, in clawing back some of the projections that we had in 2021, which were much more disastrous than where we are, and I think they should be commended. But again, I think that for me, the bigger issue is like the outlook going forward. I don't think many of those posts will be retained, and where those posts are is also a problem. I think one of the issues that we have in HR in South Africa is really this distribution. So many of the posts that were added for COVID were added in the big metros where there was a bigger impact of the COVID pandemic. And in some ways, the 41 rural districts were under-resourced and underrepresented in that. And keeping some of those posts doesn't address the distributional inequality in availability of professions across the country, rather than just in the 5 metros. I think added to that, yes, I think the current budget does you can't run away from the uncertainties, right? And I think there needs to be a greater emphasis on, like Mark speaks about the SRD grant, we also have to look at healthcare in a similar way. We spend 240 plus billion rand on a publicly funded healthcare, but how it responds to the healthcare needs of the broader population is something that I think we need to have another look at. We're still spending 6% of that budget at hospitals. Those hospitals are still sitting at, probably overrepresented in urban areas rather than in rural areas. We do have poor healthcare utilization in primary healthcare, despite increases in that. And I think we're far too passive. And I think, if anything, right now, we can't continue with business as usual. We can't afford to continue sustaining the current expenditure on healthcare in the way that we do and have an impact on universal health coverage, right? Without some kind of explicit prioritization of those most in need, right? And I think that's pretty much the 80%. We have a large non-communicable disease epidemic that's not being addressed. We have lots of variation in infectious diseases where we don't even have national numbers for HIV and TB. We have reproductive and maternal child health, which is in crisis, and we've actually had maternal mortality increase over the last 2 years. And I think the budget should actually be looking at how do we address these strategies rather than to continue maintaining the cycle that we have at the moment. We have to return to those constitutional obligations. And I think one of the questions that we need to ask ourselves is, what does progressive realization mean? When there's total inequitable enjoyment of that right, should we start beginning to look at how do we prioritize those with the least access so that we can push up access for everybody without continuing this journey of just adding budgets and thinking that somehow with more money or continuing the current institutional arrangements, we'll make a dent in population health. And I would argue that we won't. We're just making the situation worse, and we can't continue the thinking that we have at the moment. Thank you. Over.
Thanks, Russ. So we have another question, and I'm very cognizant that we've now run into time, but I'll give, before we open up for that question, and I also noted that I haven't really asked anyone in the room, but I'm sure if there were pressing questions, there'd have been a hand raised. But if there is a pressing question, let me know. What I'd like to do is that just for each of the panelists, before we close, to keep in mind the following question, and they'll answer it hopefully in about 30 seconds, which is, if they had sort of one priority to look into, or for the report to look into, Michael earlier mentioned that it is a work in progress, what's kind of work going forward. It'd be really interesting to hear from you what you would like emphasized. We've already heard a little bit, some specific inputs or suggestions, but if there are any others, please think about that, and we'll come back. We'll end off with the speakers 30 seconds each, and I think perhaps Arabo can do a very quick thank you. Her word will be last. So let's have that question. Then we'll hand over to the 30-second inputs. We'll start with Daniel, then Mark and Russell, then finish off with Arabo. So let's have that question.
Okay, thank you. This is also from Neil Coleman, and it's also to Mark Blecher. So he's saying that Mark also implied that the commodities boom wasn't going to be sustained. Is Treasury planning based on the assumption that the boom will not continue on to 2023?
Okay, so go for it, Mark. And then I think you can add your 30-second wish list item for the report.
Sorry, I think Edgar's better to answer that question, but should I give... But I think the wish list is not really for me, perhaps. But maybe if you're asking me to make a closing comment before Edgar comes in, just to say, well, thank you very much for the report. I think it's a really great report. Just perhaps the one thing to emphasize, given that, I think a lot of the inputs have been very negative in this presentation, is, not to forget, I think that 282 billion was added in budget 22. So it's not that nothing was done. 282 billion was added, and so I think we've gone through a period of tremendous instability. Let's see how things progress in the coming months and year in the next budget. Thank you. Ed, can you answer that question, please?
I can't tell. Can I have an indication if Edgar's still on the line? No, he's not. Sorry, Mark, you're on your own.
So I'm not actually in a position to answer that. Also because I think between the MTBPSs and the main budgets, Treasury I think doesn't necessarily give its forward revenue projections. But I also actually don't know the exact answer to that question. So I think the commodity boom may go on a couple of months more, but I think these are the kind of questions that we face in every budget, and I think we will see changes before the 23 budget, but that's what the work is going to be over the next few months. So sorry, I can't actually provide more information about our projections on the duration of the commodity boom, but you could put that to our tax section if you like. Thanks.
Great. Thanks, Mark. Had I said Daniel, Russell, then over to Arabo.
Thanks, Zuki. Yeah, look, I think I won't repeat anything I said in my earlier presentation, but just following on the questions which were asked about the 350 grant and merging conversations around basic income grant, I think I would just implore the National Treasury and the government to and this project to help take us forward through having some honest conversations in addition to spending policy, but also about debt and taxes. Because whilst we're in this austerity mindset, I think it's really clouding our vision of what is possible in terms of the 350 grant, especially. On that particular issue, there's so much evidence internationally. There's a lot of evidence in South Africa from the NIDS-CRAM and from other studies which have been done since the grant was introduced, and so much evidence on basic income and the effects of that on growth, on inequality, on income distribution, that if we approach it from this pure austerity mindset that we can have no more debt, no more taxes, then the outcome is likely to be that we ignore a lot of the evidence, we don't realize some of the potential benefits, and that we actually trade off social grant spending against basic education, healthcare, and other spending. So I would like us, through this project and then further conversations, to have more public conversations about the possibilities and opportunities of these spending decisions. But we clearly do need to also have a conversation about public debt and taxes as well.
Thanks, Dan. Russ.
Yeah, I think all of those things are very commendable, and I think it'd be really great. But we are facing a real and immediate crisis, right? And I think our outlook, there's lots of uncertainty, and public provision is reliant on income, right? And if without any clear prioritization process, we'll be in trouble, and we'll have further regression in the realization of socioeconomic rights, particularly health and education. But what I'd like to see is probably like with healthcare in particular, while we have all these elegant arguments at a national level, many of the sort of implementation decisions are being made at a provincial level. So going forward, I would probably like to see an investigation into or an understanding of resource allocation processes at the provincial level and the extent to which they consider the impact of budget decisions made on the realization of socioeconomic rights, and for greater transparency around how those decisions are made. And I think the second thing for me is also to see we can't continue funding the health system in the way that we do at the moment. And I think there was a report that came out from the MRC that looked at just administrative records at a number of hospitals in NHI pilot districts. And I think the results were very scary, with only 40% of them being able to produce discharge records. So I think we need to invest in understanding some of these operational efficiencies as we look forward to an environment where there be very little money. So I'd like to see a consolidation on hospital expenditure and a better understanding of what happens in our hospitals and how they are funded. And then secondly, I'd like to see what do we need to do to invest more in primary healthcare up to the district hospital level, so that we can start at least giving it a little bit as we consolidate elsewhere. And greater investments in PHC up to district hospital, I think, will be very in line with our constitutional obligations. And those are probably currently the people with the least access to healthcare. And that was demonstrated in the response to the COVID pandemic. Thank you.
Thanks.
Over.
Great. Thanks, everyone. And last word to Arabo. Thank you so much, everyone, for the inputs.
Thank you. I'll start off with the priority for the report, if I may. If we could just get the data and everything was available, what would we... I think one of the things we struggled with from the healthcare section was what's an adequate measure of how effective or how efficient the spending is. So there were issues with utilization rates, but what's that way that we could look at that would tell us, with basic education, you can look at LANA numbers and things like that, but what is that for healthcare? So that's the one thing that we'd like to probably wrap our heads around. But also, as Mark was saying, when we do the social grants work, we always get the question, but is that the right measure? Is that the right deflator? So a sense of what would that look like? What's the best deflator that we could apply that would not be universally accepted, but would not be as faulted? And finally, I'd just like to say thank you to everyone for the engagement here and for the upcoming work. And if there are any other comments after this, please feel free to message Michael or Wait or myself. We'll still be finalizing that in the weeks to come. And thank you very much, Zuki. It was nice to share the panel with you. Cheers.
Thanks, everyone.